So this is just a quick and efficient video, just kind of determine and differentiate when to use midazolam versus ketamine and their benefits. Because ketamine is obviously stipulated under the medical directives reserved for excited delirium or severe violent psychosis, because at those dosages, we're creating those dissociative effects. And we always have to remember, like, we're giving a procedure that is not consented for. So obviously the risks to giving sedation, especially when it's not consented for, can lead to a higher risk of depression, post-traumatic stress disorder, because it's pretty traumatic getting the medication when they're going through an insult and they have to be sedated against their will. So we have to be mindful of that. And obviously we're not trying to achieve general anesthesia dosages here. We're just trying to achieve mild sedation for midazolam and dissociative effects for the ketamine. That's why we give those dosages, and that's why we reserve ketamine for those explicit states, because it's like, you're so violent psychosis, you're such a threat of my partner, other bystanders on scene, and the patient themselves. It's like, you need dissociated doses to subdue you, to create a safe situation. That's why we only reserve it for those circumstances. So midazolam. Midazolam is the preferred sedative agent for undifferentiated agitation, and as well as for alcohol withdrawal, autism spectrum disorder, if you have the elderly going through behavioral disturbances, and other similar situations like that, because that is involved in the limbic system. The limbic system encompasses like our emotions, our regulation, and obviously that has a complete intersection of our memory. And you can see all the different aspects of the brain that are involved in the limbic system, which again is involved in emotion and regulation. So if you give someone midazolam, you hyperpolarize the cell because of the influx of the chloride, and that leads to sedation. That leads to antegrade amnesia. That leads to like this, you're cooperative, you're still awake, you're still lucid, you still have cardiorespiratory function, because we try to give the least amount of sedative to achieve safety and just calm you down so you're no longer a threat to everyone. So that's why there's different levels of sedation. You have minor, moderate, deep sedation, and obviously general anesthesia. So that's all we want to achieve. And this is why patients are prescribed benzodiazepines if they have anxiety, because obviously that's a dysregulation in their limbic system. So that's why they normally take it. And obviously if patients have anxiety or are prescribed a benzodiazepine, they may need more benzo. It's kind of tailored to them because they've developed a tolerance and dependence on it. That's why. But most circumstances, it involves the limbic system dysregulation, and that's why midazolam can be beneficial. So we look at ketamine. From 18 years old to 64 years old, we give 5 milligrams per kilogram. 65 years and up, we give 3 milligrams per kilogram. But we're trying to achieve dissociation with those dosages. So obviously ketamine is involved in different areas of the brain as well. There's more to it than what's on the screen, and there is some overlap from the limbic system too that is involved in midazolam. But the prefrontal cortex is involved in this dissociation because that has higher executive functioning of our brain. It's involved in sensories kind of inputs. But if you cause dissociation and ketamine binds to the NMDA receptors, you just disrupt that sensory output, and overall they have this sense of dissociation. So they cannot physically like determine what's going on. They have this out of body experience. Again, they're floating in this dream-like state, like in the other dimension. Hippocampus is involved in memory formation. So if ketamine is given at the dosages, it can obviously lead to amnesia, because you cannot create those new memories, so you cannot remember the event or remember that event that well. And obviously the thalamus is kind of like the relay station that sends signals. So again, that's why midazolam is typically reserved for those experiencing behavioral dysregulation. If they have a history of autism spectrum disorder and they're going through an episode today, obviously benzos would be the preferred agent for that, and we just want to achieve minimal sedation. So they're calmed down now, they're not a threat to anyone, and they still preserve their cardiorespiratory functions. In comparison, ketamine is reserved for those experiencing severe violent psychosis and excited delirium, because we want to achieve dissociation, so they're no longer a threat to everyone on scene, and these are the reasons why it happens.